Sure. Hi, everyone. So my name is Maureen O'Donnell, and I have here with me today Seán Ó Sé, Robert Hurley, and Olive McCafferty, and we are going to talk to you about advocacy. And our agenda for this talk is first, I'm going to provide an overview of advocacy. That's going to be about 15 minutes or so. Then we're going to have examples of advocacy from the work that Seán and Rob and Olive have done for us, for ILFA. And then we'll turn it over to discussion. Before we turn it over to discussion, actually, I'll come back in and provide some very specific guidance around advocacy if you'd like to advocate for ILFA. And then we'll turn it over to discussion. So that's our agenda. First thing, I suppose, in terms of advocacy is, what is it? What's our definition, our level setting, if you will? And ILFA has a definition that talks about supporting and empowering people to communicate both their will and their preference, secure their rights, and represent their interests. So essentially being able to obtain the services that they need. And advocacy can be done at the individual level. And an example of that would be the ILFA patient charter, which you can take to your medical professionals and say, these are my entitlements. This is what I should have in terms of medical care. And it can also be done by advocacy groups. And ILFA has a much broader remit than just advocacy, but that is one of our 4 core aims. And what we have here is the definition across our advocacy page on the website, where we talk about, we work at all levels of government, representing lung fibrosis patients, ensuring that they get the care that they need and have the best quality of life possible. Why we advocate is we advocate basically to drive change, and that change being improvements generally in the services that are provided to patients. And we do that by shifting the balance of power. One person can go and say, I'm not getting a particular service, and that's kind of one level of power. But ILFA, we have more than 1,200 members. If you think about that, what that means in terms of lung fibrosis, that's basically, what is it, about 20-25% of the total potential patient population. It's like the equivalent of perhaps 2.5 specialist centers. That's quite powerful when you think about all of the people that we represent. And so because we represent so many people, we then are able to perhaps have conversations and with people that an individual might not be able to, and get services for folks that they themselves might not be able to get just on their own. And we're doing that, I suppose, with the intention of upholding and asserting your human rights, because fundamental human right is the right to be able to live a long and healthy life if you so choose. And in some cases, that's not being upheld by some of the services that are provided in our case. So the way that we advocate, we use the political system. And basically what that means is that we are working with TDs, senators, other people in government, Department of Health sometimes, to hold the HSE to account. And what would be lovely is if we could just go to the HSE and say, please, can you help us? And they say, sure, absolutely. How can we help you provide better care, or equitable care is what we're advocating for to lung fibrosis patients. But the HSE, being a giant bureaucracy and serving millions of people, doesn't have the time or the resources to be able to work with groups individually. So we need to put pressure on them. We need to be, as my mom always says, the squeaky wheel that gets the grease. And so that's what we do. And we basically go to the bosses of the HSE, which are the politicians, specifically the ministers. And we do that through a variety of mechanisms. There's parliamentary questions, leaders' questions, there's freedom of information requests. For example, I just did a freedom of information request on oxygen, on the oxygen contract changeover. I want to be able to discover how that contract changeover went based on the information the HSE kept about it themselves, to be able to understand whether or not that contract changeover was done well, and whether you're actually getting better oxygen service as a result of that changeover, or whether it hasn't improved. We also have individual meetings with ministers, with TDs, and with senators. And within that group of people, because there's hundreds of people potentially that we could be talking to and meeting with, we've got our list of VIPs. These are people that can actually help us most in the areas that we're trying to advocate for. And our number one VIP is the Minister for Health, currently Jennifer Carroll McNeil. The Minister for Finance is also really important to us because he controls the purse strings. And then the other ministries, particularly rural and community development and the Ministry for Older People, in that they also have funding that they can potentially give to help improve services. We focus on the government parties, Fine Gael and Fianna Fáil, backbenchers in particular, because you can't generally just go to a minister and say, hey, I'd like to meet with you. And they say, sure, no problem, Friday's free. Because they're getting thousands of requests to meet. And so what we have to do is we have to go to other people in their party and say, we want to meet with the minister. Can you help us get that meeting? And if we do that enough and we're strong enough about it, they're able to get us that meeting. And then once we get that meeting with the minister, that then puts the pressure on the HSE. So the parliamentary questions are great. The freedom of information requests are great. Briefings that we do, all of these other sorts of things that we provide are helpful. But when we get the meeting with the minister, and here at the end of August, we've got a meeting with the Minister for Health. So that's great. That really moves things forward. When the government isn't helping us, which is what we saw kind of at the beginning of this year, when the government was just forming, so it wasn't really able to, because it didn't have its own act together, it wasn't really able to help us or other charities. We then leveraged the opposition parties to start pushing on the government, who then push on the HSE. So we did that for the first couple months of this year. Now we've switched our strategies back to the government because they are now being responsive to us. And then because there's a whole universe of people that you could potentially be talking to, there's folks that we tend not to focus on, and that would be our local councillors or other ministries like Justice or Department of Climate, just because while they're lovely people, they probably can't help us as much as the health and finance portfolios can. And then just to say, as I mentioned, these ministers and these groups are receiving an awful lot of requests from an awful lot of charities. Just two examples of that. We did a pre-budget submission this year. We did a pre-budget submission last year as well. Last year, we were 1 in 600 pre-budget submissions that all went to one guy. So as you can imagine, the volume of information that they're getting is a lot. We put in maybe 50 parliamentary questions last year. The total volume was about 10,000. So it's kind of like news today. It takes an awful lot to rise above the noise. So that's how we advocate. And then just to give you a couple of the wins that we had last year and early this year, I was really excited last year when we got the first ever funding for lung fibrosis in budget 2025. They allocated 500,000 in 2025 and then another 500,000 in 2026. So that's €1 million. We were very excited about that. In January, we started meeting with the HSE and the Department of Health because we wanted to say, okay, here's how we want to spend that money. And we received preliminary agreement on it. It was an ILD disease registry, community pulmonary rehabilitation pilot with the intention of broadening that out across the country. And then funding for us to be able to hire a nurse so that we could have that technical medical expertise on staff, and then also provide a grant scheme to patients that are struggling with the cost of managing their condition. So we had agreed on that in January. And because of the wonderful bureaucracy of the HSE, that money is still completely unspent. So it's still sitting as a line item on the budget. And the meeting that we're having with the minister at the end of August, you can absolutely bet is going to be all about why that money is still stuck and how we're going to unstick it. We've been pestering the HSE through the political system for the entire year, but thus far that money hasn't gotten unstuck. Another thing that took a long time to deliver, but finally did get delivered this year, was the clinical advisor pathway. That's Killian Hurley. You may know him from Beaumont. He is doing a gap analysis, trying to understand the state of care for lung fibrosis patients across Ireland and identifying the inconsistencies and the gaps with an intention of being able to increase the services across the whole of the country for folks. Now, that took 2 years and 2 months for him to get in that role, but he is at least moving forward now with his work. So that's some of the things that we accomplished. And as I mentioned, some of the challenges that we've had, we still haven't unlocked that funding. We don't have agreement yet on a clinical program. Clinical program is what we believe is going to deliver that care that everybody needs across the country, no matter where you are, whether you're in Donegal or in Dublin, you're going to get the proper care that you need. Right now, that's not the case. We've got other financial supports that we're advocating for, things like medical cards, tax rebates to offset electricity costs and travel costs. That hasn't been agreed yet. As I mentioned, that oxygen contract changeover and the provision of oxygen, it doesn't seem to have gotten any better for a lot of people from before the contract began. And then the last thing is the number of lung transplants has gone way down since 2019. In 2019, there were around 35 lung transplants in Ireland. Last year, I think there was less than 10. And this year, it was also in the single digits thus far. So we're trying to get to the bottom of that, figure out why that's the case, and turn that around so that we can get more people who want transplants. So that's what we're advocating for. And then before I turn this over to Seán and to Rob and to Olive to give you some examples of the advocacy work that they've done, I wanted to just broadly talk about how our members help us advocate. One big thing that members do is they contact their TDs and their senators for us. And the best example of that I've seen recently was at the end of June, we launched our strategy in the AV room at Leinster House. And it was so brilliant to see. We had over 40 TDs and senators that showed up to attend that briefing, despite it being a really busy day. And every single one of them that attended came in and said, I'm here, I am paying attention. You need to let my constituents know, so-and-so called me and wanted to make sure that I was here. So that really makes a difference when you contact your TDs and your senators and let them know that we need their help. And then also just being involved in our activities around advocacy, representing yourself and other patients as part of one of our delegations. We have, for example, in this meeting with the minister that we're going to be doing at the end of this month, Lorcan McMahon is going to come with us, and he's going to represent patients in that meeting. We also have a TD, Catherine Callahan, who has family members that had lung fibrosis, and she's going to be there as well. So these people that are connected with our patient community become really powerful advocates in those meetings. And then attending awareness events that we're having, where we're meeting with politicians, and World Lung Day. I'll talk about that in a little bit. That's one example of something that you can attend and advocate for as a part of that. So I'm pausing now, and I'm going to turn it over to Seán and to Rob and to Olive, and we're literally going to go in that order. So Seán, if you'd like to go first, I'll stop sharing my slides and we'll turn it over to you.
Thanks, Maureen. Okay, I was pleased to be invited to be an advocate for achieving equity by innovating lung fibrosis care in Ireland. Myself and Rob Hurley were patient advocates, as well as advocates Maureen and the ILFA team, who went to Leinster House in June this year. Thanks to advocacy by ILFA patients around Ireland to their local TDs and senators prior to this event, there was a high attendance by those TDs, senators and their assistants. My approach to delivering my own speech to the meeting was to describe my own difficulties that I have experienced during the course of my lung fibrosis diagnosis and subsequent treatment over the past 6 years. I'm a public health patient, and as such, I had to attend the nearest public respiratory clinic to me. Now, this was to CUH in Cork. There are only 8 public respiratory clinics in Ireland, 5 of which are in the Dublin region. Now, I live in West Kerry, so it's a 2.5-hour drive each way to CUH. During the investigations, I had to also attend other hospitals like at Bantry and at Mallow. It took the respiratory clinic 18 months to diagnose me having lung fibrosis. It's a difficult disease to diagnose sometimes. As soon as I had a positive diagnosis, I was put on antifibrotic medication straight away. And I was also recommended to start a pulmonary rehabilitation program. However, being in the public health system, I could not partake in available public pulmonary rehabilitation courses because lung fibrosis patients are not recognised as eligible by the HSE. These courses are for other patients with acknowledged, but HSE acknowledged pulmonary diseases like COPD and asthma. But thanks to joining ILFA, I do now have access to regular pulmonary rehabilitation online, provision provided by ILFA, a charity. I'm on a medical card due to my low income, but I have to pay my own travel expenses for specialist care. I am dreading the time when I will be needing supplemental oxygen, because at this point in time, there are high electricity bills to pay following the running of the oxygen equipment. In today's environment, geography and income are more likely to determine the speed and the quality of care than the severity of their symptoms. I'm a great believer that patients with lung fibrosis, their carers, medical staff, and of course members of the ILFA team can draw attention to the public figures in government, HSE, and hopefully the media to explain and educate these people of the need to provide compassionate and effective care to sufferers of lung fibrosis. Advocacy by patients and those directly impacted by lung fibrosis can be a powerful tool for people whose voices are often overlooked. Anyway, that ends my talk. Thanks, Maureen.
That was great, Seán. Thank you very much. Rob, shall we turn it over to you?
Thanks for that, Seán. I suppose I'm 52 years old. I was diagnosed 4 years ago after my pathology tests from the lung biopsy were sent to the Mater Hospital. I knew there was something wrong and not right, with not being able to run and coughing after going up a hill. But I'd already spent 2 years in the Galway clinic on steroids and nebulizers and all that. So I got into the Mater Hospital by luck, really, that by the doctor I was under ended up sending my stuff onto the Mater, and only for that I would be still in limbo, I'd say. So I'm lucky in one way, but then probably 3 years before I got diagnosed. I found it difficult to tell the family, but when I did, we were able to put a plan in place, meant giving up work and stuff like that. There was a big financial burden, kids going to college and stuff like that. So all that was running through my head at the time. So when I came clean with everybody, and you think you're hiding it, but you're not. They knew themselves, but everybody was on eggshells. But it was a huge relief when it was lifted off my shoulders. But the first day I was on my own, I basically signed up with ILFA because I had the time now, and ended up doing the ILFA classes online. This was probably the main reason why I got back to a level of fitness that I can go walking now every day. And it's important to keep it up because you have to be ready at any time to be in a state for a lung. To get the lung transplant, you have to be fairly fit and fairly mobile on it. I was also able to meet people online that were similar problems, and I was able to ask questions because I knew nothing about this disease. So I was able to ask about, like the tablets and the reactions and, how people felt. So all those people actually taught me everything that I know about it more than any doctor. And that's a side that the classes you don't really see, but it's a mental and physical, and it's a brilliant way of educating yourself. Up to then I was paddling my own canoe from, I'm on 6 liters of oxygen, so the oxygen just arrived at our house, who was paying for it and all that stuff. But you were able to ask all those people now how to apply it, how to get the drug refunds cards and all that. So it has a lot more benefit than just turning up for 2 hours a week. And out of those conversations, I got to know Gemma. And one day in 24, I was speaking to Gemma, and she was telling me how difficult it was to get before the health committee in the Dáil, and I couldn't understand it. it was 2 or 3 years. And Jim had me on the list of TDs, and there just happened to be one on the committee from Clare that I knew and I'd worked with before. So I went in and met Cathal Crowe for 20 minutes, which ended up to being an hour of a conversation. So I told him my whole story from start to finish. And after that, Cathal organised a meeting with ILFA and the TDs in March last year. And that led to a meeting with the Health Committee in April 2024. I suppose we have started to make the progress, and we have received the money, but we have to drive it on again. And that leads us to the patient advocates. We have an important role in highlighting the lung disease because we're the ones suffering with it. The difficulties in getting diagnosed, access to medication and clinics. As I said, I'm one of the lucky ones. So by telling our story, to me, a real life situation is worth a lot more, and it means a lot more. And then they go back and feel they get things done, you know. So, but it's important that we as advocates, and the more they can tell their story, the better, because like this is my second year doing the advocacy, but it needs more people because you can't come back with the same story every time. So I would urge anyone there that has, every story is different and the disease is so rare, it's very difficult to highlight it. And the rare disease, when a rare disease, the more people we can highlight together and speak together. And through ILFA, I think we can make a lot of success in highlighting our disease because it's not recognised in a lot of places. Even the HSE haven't recognised it, even though it's a life-threatening illness. So it's very important for us with the sports, clinical pathways, and respiratory nurses and pulmonary fibrosis clinics. We've done a lot at the moment in the last 2 years. I think we're moving on, but it has to be driven on again. So my message is for people out there, don't be afraid to contact Gemma because they're doing wonderful work. And thanks to everybody involved with not just Gemma and everybody is playing their part in it. So look, I have no more to say, and only just please help if you can.
Beautiful. Thank you very much for that, Rob. That was great. That was great. And our third speaker that we have here is we've got Olive.
I'm just going to test that you can all hear me. Yeah.
Yep, we can hear you.
Thank you. Thanks firstly to Gemma and Maureen for asking me to speak today. I'm sure I know a few faces already, and yeah, it's always a pleasure to work with ILFA, and I'm more than happy to be an advocate for you guys because my role is a physiotherapist in the Mater Hospital, and I work in the lung and heart transplant unit. So over the last few years, we've seen the growing number of patients coming in with lung fibrosis requiring a transplant. And I suppose through that work, I see maybe the inequality of care that these patients are getting within Ireland compared to maybe some other diseases that patients have from a respiratory point of view. And I suppose that has led me to being so involved with ILFA, and also some of my advocacy work that I do within my own job. I suppose some of that would be within the hospital itself, like advocating for patients, particularly those ILD patients or pulmonary fibrosis patients. And a big role I play as well is I do a lot of outreach of education to different centres across Ireland in terms of education on how to manage patients with pulmonary fibrosis, because they are different patients that maybe have COPD. It might be something that people have heard. Your disease is different to these other lung diseases. So I provide a lot of education and resources for nurses and physiotherapists on how to manage that, like how to provide best care. I suppose I have a good understanding of the guidelines, and we mainly go off the UK guidelines because we don't have any ourselves in Ireland because it isn't recognised. And I suppose that's what I'm basing my my advocacy on, is that we want the same standard of care as if you had lung fibrosis in the UK or America or anywhere else in the world, that you would be getting the best treatment possible, the same as a COPD patient or a cystic fibrosis patient. I've done a lot of work with ILFA as well. I was along in the AV room as well, and I suppose it's nice for me to be able to tell my story from a practitioner point of view of maybe some of the barriers that we encounter. And I suppose one of the things that Seán highlighted and Rob highlighted was that lack of access for pulmonary fibrosis patients to pulmonary rehab. You know, not only is this an excellent resource for you guys to hopefully one day have equal access to, but it's shown to have improvements in quality of life, in your ability to manage your own disease as well. So that's a big thing. I've drawn in a lot of favors over the last few years from different places of kind of begging for my patients to get access for pulmonary rehab. And I suppose through my education to the different centres, I've been advocating for them to kind of open the doors a little bit more, even though it's out with their kind of a remit. I've been asking them to kind of open the doors a little bit more to allow access for people with pulmonary fibrosis, to allow them into pulmonary rehab, because I think you, just the same as anyone else, should have access to that, and the research shows that you will benefit from that. I suppose another part as well is when the oxygen prescription or the oxygen new companies were being tendered for. I suppose I was advocating for you guys, saying the trouble that you guys have, maybe the downfalls that maybe weren't being highlighted by the HSE or the companies, and maybe to try and iron them out more. I suppose one thing I would say is if you do have trouble with your oxygen, is there is an avenue to advocate for yourself. It's called Your Service, Your Say. So the HSE is paying for this oxygen if you are a medical card holder. And if you do have problems with the oxygen, you should be going onto the website, Your Service, Your Say, HSE. You can put in your complaint, or maybe it's even feedback. And that's a really nice way of maybe highlighting gaps or maybe areas to improve in terms of oxygen prescription. And that's the way the HSE has advised me to advise people to have their say in terms of the oxygen, or anything at all, to be honest. It doesn't have to be just about oxygen. So I think the other guys have really highlighted that the strength in numbers is so important. So being involved with ILFA, being involved with the pulmonary rehab classes that they provide, so that we can show the HSE there is such a demand for services for people with pulmonary fibrosis is so important. So I think the more people we get involved, the more TDs and senators hear, people chiming in their ears, I suppose eventually they'll have to bend the knee to giving the people what they want. So get family and friends and yourselves involved is really important. And I think it's really important for yourselves, even just going to your own GP or your own doctor, is speaking up for yourself. If things aren't right, they're not right, and you know that better than anyone else. So, you know, asking for a repeat review of your oxygen or a repeat of tests if you feel that there's something not right, you know, really advocating for yourself at the most basic level, and also at a higher level with what ILFA is doing. It's really important. So you know better than yourself how you feel. If things have worsened, don't wait till your next appointment. Maybe you need an earlier appointment with your doctor to try and see if things have worsened, or is there an infection, etc. But I think it's really important for people to kind of stand up for themselves and speak out that if they're not getting the treatment, or if they're not getting reviewed quick enough, then you're probably the best person to highlight that. So yeah, that's from the most basic level of advocacy, and then all to that higher level, that joining in with what ILFA are campaigning and advocating for you guys, because they are doing probably work that they shouldn't need to do, because the HSE should be providing it. So that's why I'm always here to help and to give my part of the story from a practitioner point of view. But yeah, thank you again to Gemma and to Maureen for inviting me today, and happy to answer any questions when the question section comes up as well.
That's great. Thank you, Olive. I appreciate that. And Rob and Seán, thank you as well for sharing your stories. I hope that that's given you a little bit of context and a few examples to kind of understand the work that we're doing around advocacy. And as you probably heard yourself, what I heard in those examples in particular was the power of the personal stories. There is absolutely nothing like lived experience to be able to communicate that to these politicians. And I have yet to see a politician that isn't moved, that doesn't want to help. when they're hearing straight from patients the problems that they're having in services. So that's a really important point. And in my last 2 slides here, which I'm going to switch back over and start sharing once again, my PowerPoint presentation. Can you see the PowerPoint presentation?
Yes.
Super, thank you. So you just heard a couple of our world-class activists helping describe for you how they do their advocacy, talking about their lung fibrosis journey, for example, as Seán did, how it took him 18 months to get diagnosed, how he was traveling all over the place, trying to get that diagnosis in the first place, how he struggled with getting services. You know, you heard from Gemma. Can I ask you to do me a favor and mute Gerard? It looks like isn't quite on mute there. So we just need to mute that to stop the background noise.
Okay.
Thank you. Rob talked as well about his experience in diagnosis and his concerns around oxygen and how important the exercise classes were for him. And then also he talked quite powerfully about the advocacy work that he's done for ILFA and what that meant in terms of us being able to get a meeting with the health committee, which like that is very rare to get a meeting with the health committee. And Rob was the one that facilitated that just by knowing a politician that was able to get us into that meeting. So by meeting with him, telling the story, that then motivated that politician to come back, and through subsequent conversations, they were able to get us the meeting with the health committee last year, which was brilliant. So here's a recommendation. If you are going to advocate for us, and the final slide will have the opportunities to advocate for us. But if you are going to advocate for us, here are the tips. It's basically 3 sections of a conversation that you have. The first section is you summarize your journey in hopefully 5 minutes or less. If you can do that, then that is quite powerful. Then maybe talk about ILFA for a little bit. And there's a few tips around talking about ILFA, but even just, you know, mentioning one thing that you really appreciate about the work that we're doing to support you, that lets them, the politician, know that, hey, you're not on your own. You're actually a part of this bigger group of people that are advocating as well. And then you ask for what you want. So in summarizing your personal story, being able to talk about how you were diagnosed and when, how that diagnosis has impacted you. You heard that from Seán as well as from Rob. Some of the key issues that you're struggling with, they both identified that as well. And then it's always nice, I think, when you're trying to tell a personal story, to talk about like what helps you. You know, maybe you've got family that's been incredibly supportive, or maybe there's a medical professional like Olive who is always there for you whenever you need her to be, or maybe you've got a beautiful garden in the back that you go out and tend to your flowers on a nice day, and all of those things kind of help restore you. So just being able to highlight maybe a little bit about, you know, despite this big challenge I'm facing, I'm really thankful for this. And ILFA is out there working for me. They've been around for 20 years. They've been helping lung fibrosis patients and their family for that time. You can talk about our 4 pillars of advocating, educating, supporting, engaging in research. But if you don't remember all of that, you can just say, what I particularly appreciate about ILFA is the exercise classes. As you heard from Rob talking about how that keeps you in shape, or from Olive in terms of filling that gap because people don't get respiratory physiotherapy across the country. And then once you've talked about ILFA for a little bit, then you say, okay, and here's what we want. And we frame it in this frame of inequitable. You can just call it unfair if you don't like inequitable. It's not fair. And it's not fair that some people, particularly as Seán mentioned, if you're in Dublin and that's where one of the 5 of 8 centers is, you can probably get that access pretty easy. But if you're in Kerry, you're not going to be able to get that same level of care probably without traveling significantly. And maybe you may not be able to get that care at all because maybe you can't travel that far. If you're in Donegal, same sort of story. If you're in Clare, same sort of story. So some people get great care, some people aren't able to get great care. So as a result, we've got this inequity or this unfairness. So we want to level the playing field. We want everybody, as Olive mentioned, to get the care that they need. The way that that happens is through a clinical program. A clinical program will provide the framework for anybody that gets diagnosed to be able to get respiratory physiotherapy, mental health supports, affordable medication, ongoing regular monitoring, all of those sorts of things that you need to be able to effectively manage your condition. And then maybe beyond that, then there's a specific campaign ask that we're doing at this particular time. So if you're just meeting, for example, you go to an event and your local TD is there, maybe you give them all this information and then that's kind of the end of it. But maybe there's a specific campaign ask that we're pushing for. And as I mentioned, an example of that was when we were doing the strategy launch at the end of June and people were contacting their TD. The specific campaign ask was, please show up for this briefing that ILFA is going to be doing at the end of June. Now we've got a new campaign that we're doing at the moment. And this is our specific ask now. We're asking, and we're going to be putting out a message to all of our members, asking them to call or visit their TDs or senators, preferably a week or two before the 25th of September, which is the day, and let them know that we are holding an awareness day. We're going to be at Buswells. So we're going to be doing lung function testing, and we're going to be doing advocacy work for all of the TDs and the senators and the political folks that show up. And Catherine Callahan, I mentioned that TD whose family has been affected by lung fibrosis, she's sponsoring the event for us. So she's going to be able to turn out some folks, but we're going to need our member community to turn out everybody else. And it should be a really, really, really exciting morning there at Buswells. And then in the afternoon, what we're going to be doing is we're going to be having a fundraiser on King Street in Dublin. So if you can make one or the other, that would be great. We'd love to see you. Pop your head in and say hello. And that'll be an advocacy opportunity as well for the politicians that show up on the day. If you happen to know them, maybe like Rob, you can have a chat with them. Maybe they're on the health committee and they can get us a health committee meeting this year, which is one of the things that we're trying to do at the moment. So we've got our meeting with the Minister for Health. We're happy there. We still need a meeting with the Minister for Finance. So if you in your constituency have the Minister for Finance or Fine Gael TDs, if you can contact them and let them know that we are trying to get a meeting with the Minister for Finance, once again, telling your story, talking about ILFA, and then talking about how we're fighting for equitable or fair care. And what we need to meet with the Minister for Finance on a specific issue. And if they say, oh, sorry, no, can't do that, that's really hard to get a meeting with the minister, sorry, then what you can do alternatively is you can say, okay, well, will you, TD, meet with ILFA so that ILFA can talk to you about what specifically the issue is, and then perhaps that will motivate you to facilitate a meeting with the Minister for Finance. So that's one thing. The other thing that we're trying to do is we're trying to get, as I mentioned before, the health committee again. We did that last year. That was what Rob was talking to you about. We want to do that again in 2025. We've put in a request and thus far we haven't gotten on the agenda. So the tricky bit about that is this year it's led by Pádraig Rice and he's in the Social Democrats. We've made lots of efforts to reach out to him and thus far he has been completely unresponsive. Caught him in a hallway once over at Leinster House and I got to chat with him for like 5 minutes and that was it. So if Pádraig Rice is in, I believe he's in Cork, if you're in the Cork constituency, if you can get a meeting with him, that would be huge. And we would support that as well. Just let us know that you've got that. So that's really what we're trying to do around September 25th, which is World Lung Day. We've got the campaign in Buswells for the TDs and the senators where we're doing awareness and advocacy. And then in the afternoon, we've got the fundraiser on King Street in Dublin. And then the last thing that I'll ask, and then we can turn it over to the Q&A, is, do you have a voice for radio? I have a face for radio. Do you have a voice for radio? If you do, we need your help. We are going to be running radio spots in September across RTE and all of the radio stations. And we need people to record 20-second spots. We need one man and one woman. So we only need 2 people, but we kind of need them identified by the end of this week. So if you would like to go to Rathmines, you should be Dublin based. If you would go to Rathmines, which is where the recording studio is, and you could record a 20-second spot for us, we have the script. You basically just have to read it. Then that would be amazing, because I would love on the radio to have lung fibrosis patients educating the public about lung fibrosis. And this gives us an opportunity to do that. So just let me know or let Gemma know if you want to do that.